My name is Thomas Kalinchik. I'm a professor of neurology and a biostatistician at the University of Melbourne and the MS Centre at the Royal Melbourne Hospital. So when I'm not analysing data, you can find me climbing rocks around rural areas of Victoria. I'm a passionate rock climber, and I like to spend days with my family on the rocks. The mainstay of treatment of multiple sclerosis is prevention. We're not very good at reconstructing human brains and spinal cords. So what we are focusing on is protecting brains and spinal cords from immune system that's got misguided and is ready to attack the central nervous system of a person with multiple sclerosis. So from that, it follows that we are not very good at, fortunately, reconstructing the damage or reversing the damage that's already occurred. Fortunately, there are a number of other research projects that are currently underway that are exploring approaches to regeneration. But here, what we want to do is to identify a very subtle, measurable, quantifiable signs of worsening that may be so subtle that even the patient living with MS is not aware of them. And that should provide us with an opportunity to modify treatment so that we stop this very subtle evolution of worsening of symptoms or disability, if you wish, before it actually becomes a permanent and irreversible disability in the future. So to put it in a simple words, what we're trying to do is to devise a method to diagnose subtle worsening of symptoms, measure them, and prevent them before they lead to irreversible disability. We live in an exciting time where there is a lot of culmination of research that has been done over the previous years, and what we may call challenges have actually become fantastic research opportunities. There is a handful of projects that are mature and that are reaching the stage where we are going to learn about information that can be directly translated into practice, information about neuroregeneration, about remyelination. We're learning about novel options for treatment of progression in multiple sclerosis. And with recent advances, we are starting to understand more about the origins of multiple sclerosis and how we could potentially, for the future generations, even prevent the multiple sclerosis in people even before they are present with their first symptoms. And to our patients and their families and people living with MS out there, we are in this with you. We're working together. We are working to find new treatments. We are working to find new ways to detect change and act on it. And we keep working hard until we defeat this disease.